Very good morning, everyone. We are very pleased to welcome you to the second day of the 13th Safety Gala virtual workshop. Whether you have just joined us or already had a good time with us yesterday. I would like to share with all of you how excited we are. While in lockdown, we were very skeptical about if to go virtual with the Safety Gala, not knowing what to expect. We were afraid that we could jeopardize a successful event. So having in mind that in the midst of every crisis lies great opportunity, we decided to go ahead hoping for the best. But what we have experienced yesterday was far beyond every expectation. We opened the event with near 1,000 registrations from different corners of the world, making this event a truly international one. The same with our speakers. We had the opportunity to listen to speakers from Europe, Middle East, USA, and from the positive feedback we have received so far from you, we have every reason to be excited, because the bottom line is you to be satisfied. After all, our motto is, it is all about people. Again, I would like to express our gratitude to each and every one of you that have supported us to make this event a successful one. And again, a huge bravo to the ERA Ltd team, who helped us all the way to organize such a big event. They have delivered us an exceptionally high quality platform, but you must judge that for yourselves. We do hope that you have a most fruitful time today and really enjoy it. At this point, I would like to give the floor to Mr. Eusebios Hadjikostas, who will moderate the first part of session 5, virtualization of work. Mr. Hadjikostas, he's a chemist. He holds a master's degree in business administration, and he's the managing director of the training center Quintessence Enterprise Ltd. And is a trainer of vocational training for safety and health professionals. He is also a business consultant for the provision of external services for the protection and prevention of occupational risks. Mr. Hadjikostas, you have the floor. Thank you from my side.
Thank you very much, Nilsa, for giving me the floor, which I will share with the three distinguished speakers in this session. Virtualization of work. This is the topic of this session. Nowadays, with the pandemic, we are experiencing amazing challenges. We are exposed to new risks. We suffer from new diseases, most of them not well known yet. I say that we are witnessing a pandemic of psychosocial diseases these days. Well, who are our distinguished speakers in this session? Professor Elpidoforos Sotiriadis, occupational medicine physician and epidemiologist. Dr. Cleo Varianou Michaelidis, occupational safety and health researcher. And Mr. Theophilos Kourounis, chemical engineer, personal protective equipment specialist. Work from home is a health and safety challenge, Professor Sotiriadis says. Is it? Everything in life is a challenge, let alone the pandemic. A real challenge is to dig deeper into the psychosocial dimension of the worker's life, maybe. Well, work from home, health and safety challenges. This is the first topic presented by Professor Elpidoforos Sotiriadis. The presentation will pivot around the health and safety challenges of working from home. Several issues regarding the hazards of the working environment arise with respect to flexible occupational settings, either from home or from other places outside the physical workplace. In summary, medical, ethical, and legal issues will be reviewed by Professor Sotiriadis in relation to work from home, including the current challenges with the epidemic of SARS-CoV-2. Dr. Elpidoforos Sotiriadis is an occupational medicine physician and epidemiologist with extensive experience as a practicing consultant in the field of occupational medicine in Cyprus for more than 15 years. He is also a researcher and an academic teacher, and he is currently an associate professor of epidemiology and public health at the Open University of Cyprus, while he holds also an appointment as a collaborator at the Department of Environmental Health, Harvard T.H. Chan School of Public Health. He has published more than 90 scientific articles in international peer-reviewed journals, and has been cited by more than 6,000 academic colleagues. Dr. Sotiriadis continues to be active in state-of-the-art research in epidemiology, public health, environmental health, and occupational health. He has also published extensively on different aspects of cardiovascular diseases in firefighters, infectious diseases, tobacco control, obesity, cancer, mental health, occupational stress, as well as additional research topics. Dr. Sotiriadis, the floor is yours.
Good morning to everybody. I would like to thank the organizers for inviting me to be part of this event, and I would also like to thank the Cyprus Health and Safety Association for hosting this panel. Thank you very much, Chef Sevios, for this introduction. Just give me a couple of seconds to upload my presentation. And do you see? Do you
Yes.
have access? Yes. All right. Thank you very much. I'm going to be talking about work from home as a health and safety challenge in this era. I will talk about a little bit about definitions, the workplace hazards, advantages, and disadvantages of these new occupational conditions and working arrangements, health and safety challenges, and I will touch upon the medical, ethical, and legal issues related to these new occupational arrangements and the challenges related to the current epidemic. Find a job that you enjoy and you will never work again is the motto that I like to use when I present topics in the field of occupational health. And I hope that everyone has chosen their field to be their pleasure and not feel that they are working while involved in their professional activities. Work from home, remote work, teleworking, these are terms that are being used. However, they're not equally similar. Work from home is a concept of arrangement where the employee can do his or her own work from home, and this may refer to full-time employees, part-time employees, employees who are collaborating on a consultant base with different companies, other who may serve as independent contractors, and of course, a lot of people who are self-employed. However, remote work is not exactly the same as work from home, since the employee in this situation may be working from a remote location, which may usually be their home, but not necessarily. Nowadays, we see that people may be working from a coffee shop, a library, or another co-working space near their residence. Teleworking is another term being used, which is also somewhat different from the other two terms. It's also known as telecommuting, and that means that employees may be working from home or remotely from another place using the modern technology, web-based technology, and telecommunications such as email or other web-based applications, and at the same time being in touch with their employers or businesses. Therefore, teleworking might be seen as a more restrictive arrangement, since the employee has to be more strict with respect to their time schedule in order to be connected synchronously with their businesses at the same time, while remote work or work from home might be more allowing flexibility to the employee that may choose to work one day in the morning or another day in the afternoon, as long as they satisfy the expectations of their employer with respect to outcome or end-based evaluations. Just to remind everyone that in every environment, either occupational or residential, we are facing a multitude of risks and hazards. And those are internationally categorized in these 6 categories: safety hazards, physical hazards, chemical hazards, biological hazards, ergonomic mechanical hazards, and psychosocial hazards. And under these 6 major categories, we may actually categorize almost all hazards and risks that we face on a daily basis. And these categories also apply for these newer, or if you wish, flexible working arrangements. There are several advantages as well as disadvantages for these new working conditions. And for example, if we consider the work from home or the remote work arrangements, we see that nowadays companies may have many more choices with respect to job applicants for particular job positions, because people are no longer constrained or disabled to apply for a job to work remotely from their own place and be actually employed from a company from another country or even from another continent. Therefore, employees are facing new challenges to retain their job with this increased competition. A lot of people consider working from home as an arrangement which confers better work-life balance, because they allow them to choose their own place to work in a more quieter and friendly atmosphere from their home. And they may claim that these helps them to concentrate better on their work and be more productive, and all these improved outcomes with respect to working from home. Employees may feel more motivated to build their own work office at their own place with no space restrictions or even other restrictions that are usually imposed on them from a workplace, and they are much more flexible with respect to their time schedule, their breaks, working at their own pace, and they avoid and they actually save a lot of time by not being required to commute. And also they may actually save other expenses related to the employees having to travel and go to a workplace and have other expenses. At the same time, it seems that there are a lot of savings from the part of employers, because they are no longer required to maintain office infrastructure, spaces like office spaces, and also cover the cost of maintenance, such as electricity bills and other support services for the employers. So we may see that work from home has a lot of advantages, including flexibility, motivation of employees, increased productivity, job retention from remote places, a lot of cost savings, both for employees and employers, and perhaps improved work-life balance in this whole new era of flexible working conditions. However, at the same time, people may consider even similar issues that are categorized into advantages as or disadvantages. For example, a lot of people claim that work-life balance is worsened for people who work from home, that this isolation may have a negative effect on their personal as well as family life. There might be certain challenges with internet connectivity from home, teleworking issues, and of course the main challenge of privacy and security of information being exchanged from so many different places of home environments with a central system of a company that maintains the headquarters of information and databases of each company. There are also limitations. There might be limitations with respect to office space at home. People may not be able to designate a specific office at their home, and therefore this may impose certain limitations with respect to professional standards, equipment, and stuff like that. The cost of technological infrastructure that is required for building or putting together or accommodating an office space at home is also a concern and a cost that sometimes is covered by the employees themselves, and sometimes is covered by the company. And also there's this major issue of inequality between different positions and employees, because certain job positions cannot be accommodated by home arrangements, and therefore other employees have the opportunity to work from home or other remote places, and other employees have to actually continue to go to the workplace in order to provide their services. And another major concern with these newer arrangements is the issue of employee monitoring from the supervisors. This may actually create issues of home intrusion and privacy of the employees themselves. Of course, there are many health and safety issues that have been highlighted with respect to work from home. For example, physical hazards and physical risks, such as a lack of sun exposure, lack of physical activity, issues with air quality in the home environments, ergonomic challenges, which is a major concern for these multitude of home-based arrangements with respect to the standards and professional standards of equipment being used, the posture that is followed by employees, and of course, issues related with training on ergonomic and mechanical hazards. And a lot of research is now being done with respect to psychosocial challenges and hazards, issues referred to loneliness, isolation, communication gaps, and of course, anxiety, stress, and depression. As Eusebio's mentioned, psychosocial challenges may be one of the major issues related to these newer working arrangements. Other medical issues and medical problems reported in the international literature associated with work from home or remote work is insomnia, weight gain, issues of obesity, increased back and neck pain for many categories of employees, which may have to do with the issue of ergonomic arrangements at home environments, in general musculoskeletal problems, eye strain from continuous use of display equipment and screens, and of course mental health and burnout issues. There is this systematic review that was identified looking at flexible working conditions and their effects on employee health and well-being. And this was a Cochrane systematic review that looked at randomized controlled trials, interrupted time series, and controlled before and after studies, which examined the effects of flexible working interventions on employee health and well-being. They looked at different outcomes, both physical, mental, and general health outcomes, and ill health, and also looked at secondary outcomes, including sickness, absence, health service usage, behavioral changes, accidents, and work-life balance. And they identified only 10 studies that fulfilled their inclusion criteria. 6 of them were controlled before and after studies, reporting on interventions related to temporal flexibility, self-scheduling of shift work, flexi time, and overtime. That's the number of studies included in each category. And with respect to their findings, 4 control before and after studies on self-scheduling of shifts and 1 CBA study on gradual partial retirement reported statistically significant improvements in either primary outcomes of employees with respect to their health, including systolic blood pressure, heart rate, tiredness, mental health, and stuff like that, as well as secondary health outcomes. For example, co-workers' social support, sense of community, and no health effects were reported with respect to the above studies. Flexi time was shown not to have significant effects. And then comparing individuals working overtime and those who did not, actually that was, there's something missing there. The also really health effects were not significantly higher in the intervention group as follows. However, the effects of contractual flexibility on self-reported health were either equivocal or negative. And therefore we see that in conclusion of this systematic review that tentatively suggests that flexible working interventions that increase worker control and choice are likely to have a positive effect on health outcomes. In contrast, interventions that were motivated or dictated by organizational interests, such as fixed-term contract and involuntary part-time employment, found equivocal or negative health effects. And the authors conclude that given the partial and methodologically limited evidence base, these findings should be interpreted with caution, and that there is clear need for well-designed intervention studies to delineate the impact of flexible working conditions on health, well-being, and health inequalities. With respect to ethical issues, privacy of employees in association with employers' monitoring systems that may be intrusive and track employees at home is a major ethical issue. Work-life balance and employers' home intrusion with respect to global positioning systems, GPS, computer web tracking, cameras at home. All that issues are major ethical concerns. Pressure on employees for salary reductions due to worldwide employability, wider competition, and lower costs. Issues of 24/7 availability of employees, this mentality of always being on and available to your employer. This is a major concern, as well as the reduction of sick days, which is seen, and it's also not real, because nowadays most employees are working from their home, and therefore the need to stay at home to recover from illness is confused with work at the same time. There are, of course, legal issues with respect to complying with new policies such as the GDPR, health and safety challenges for home-based offices with respect to home-based evaluations, risk assessments of home environments, issues with employees with disabilities. There is a great need for companies to look into these issues. Methods of communication, supervision of employees on a remote basis, cyber attacks for home-based offices, coverage of specific services with respect to costs such as IT, internet, utilities at home, and of course, this major field that companies need to work, which is their work from home policies. That there is a great need to improve all these policies now with respect to these new and flexible working conditions. Challenges with respect to the current epidemic refer to the lack of boundaries and overworking. There is a lot of reports from employees that during the epidemic, their workload skyrocketed for reasons that are not readily explainable. There are more responsibilities of the employees caring for children, parents, other adults at home that may be sick at the same time. And they also have to be up to date with their responsibilities for their work. And of course, this issue that we have seen reported in the international literature, that the crowded home environment confers an increased risk of being exposed to SARS, and we know that there is an increased level of transmission of SARS-CoV in home environments where people are more crowded compared to other settings. Lack of motivation to work under these conditions of stress, anxiety, and fear are also major issues in association with the current epidemic and the employee health. In summary, work from home and other flexible working arrangements are increasing exponentially, and more so due to the current epidemic nowadays. Health and safety challenges due to these newer working conditions are very important and need quite attention from all the companies, and also the agencies in each country responsible to supervise these companies and the health and safety issues. There are advantages as well as disadvantages related to flexible working arrangements and with respect to employee health. Research studies evaluating the above questions are limited. Employers' response to employee health problems in association with work from home require new policies, medical surveillance, and other ongoing evaluations in order to be up to date with these new challenges. And there is an urgent need to evaluate the potential health problems related to work from home and other remote working arrangements, using a systematic approach in order to elicit these challenges and try to provide or devise or develop solutions for these challenges. Thank you very much for your attention.
Thank you, Professor Sotiriadis. Very interesting and very this very new topic with the challenges. There is a question. I will just read for the time being the question, and then we will answer the questions at the end of the 3 sessions, or the 3 presentations. Should employers pay for some of the costs of keeping the home operation active, I think, by the employers? For example, hearing costs, electricity costs, etc. An employee that left no other person at home would not have to heat his home or have his or her lights on. This is a question, but we will come back to the questions. Yeah, I think it is time to continue to the next speaker, who is Cleo Varianou Michaelidis. Give me a moment, sorry. Cleo has the topic about the a tool which is very interesting to hear about. We heard that, I say that there is a real blessing now with the pandemic. I call this pandemic a real blessing. Do you agree with this? And I say, why not? We've learned a lot from this pandemic. We enjoy new experiences. We assess the risk in a new approach. We are more active and more productive, as Dr. Sotiriadis said earlier. We are exposed mostly to economic and psychosocial risk factors when teleworking. Let us expand on this with Cleo, teleworking mobile application and guides. This is the topic of Cleo Varianou Michaelidis, who is an occupational safety and health, has a PhD in occupational safety and health, an MSc in safety, health and environment, a BSc in physics. Her research interests focus on the risk from age-related challenges and the application of the occupational health and safety management systems, ergonomics, teleworking, well-being. She is currently a research fellow at SAFETY of the European University of Cyprus. Cleo has worked as a health and safety consultant for 6 years. She has extensive experience in training, advising, and consulting companies on how to maintain a safe and healthy working environment, applying risk assessments, how to adhere to health and safety legislation, and how to gain certification according to the international standards ISO 9001, ISO 45001, EMAS, and ISO 14001. Cleo has experience in risk assessments and is a licensed risk assessor from the Ministry of Labour and Social Insurance. She has also been involved in several European and local projects related to health and safety, occupational health and safety. Cleo, welcome.
Thank you, Xavier. Just give me a minute to share my screen, please. Hopefully you can see my screen now.
Yes.
Okay, great. So, good morning, everyone. My name is Cleo Varianou Michaelidis. First of all, I would like to thank Management Force and Cyprus Health and Safety Association for organizing this event. I am here today on behalf of SAFETY of European University Cyprus. My presentation is about teleworking. We will try to combine the teleworking with occupational safety and health. Let me say a few words about the research group of SAFETY before I begin with my presentation. CERIDES, the Center of Risk and Decision Sciences, is actually dealing with risk in general, occupational safety and health, critical infrastructure protection, safety processes, and so on. We have three main pillars. The first one is education and training. The second is consultancy. And the third one is about research. So about the research, we participated and still participating in many local and European projects, such as Horizon 2020, FP7, DG Econ, DG Home, DG Justice, and Research Promotion Foundation of Cyprus. Before I begin the actual presentation, just give me a minute to show you a video of NAPO and the OSHA, and we will be back. So I think this video with NABO from OSHA represents the reality we face, at least at the first lockdown. COVID-19 had health, social, and economic impacts globally, changing the way people live and work. One of the main work-related challenges was that people were forced actually to work from home, having no time to be prepared. On the other hand, teleworking existed as a form of work before the pandemic. What is important to know is that employer is responsible by law for the workplace and to conduct a risk assessment. Of course, there is a huge difficulty in assessing a working environment at home. And at the same time, it is not easy for employers and labor inspection authorities to enter private premises to ensure the enforcement of legislation. Currently, there isn't any actual regulation related to this type of work. We have only a framework agreement on telework. This is actually a European agreement negotiated and implemented by social partners. And by the way, Cyprus is not included in this agreement. So these facts were the initiatives of the development of Tele-WOSH research project that I am going to present today. Before I move on with Tele-WOSH, I would like to show you two graphs. The first one is the teleworking before, and the other one is the teleworking after pandemic. So in this first graph, we can see the percentage of total teleworkers before COVID-19 pandemic. On average, in EU, there were 15 employees working from home, and in Cyprus, less than 3%, and this before the pandemic. During the pandemic in April 2020, we had on average 37% of EU citizens working from home, and in Cyprus, 33%. Taking into account the current situation of the pandemic and all the issues related with the conduct of risk assessment that we mentioned before, we submitted as a group, as a research group, with success, the research idea that I am going to present, the Tele-WOSH project, on the Research and Innovation Foundation of Cyprus. This study could provide the necessary information to employer and employees to keep a safe, healthy environment, which it's actually, this is their homes now, and also fulfill legal requirements. The main aim of the project is to find simple solution, face the hazards of teleworking, and yet solve OSH issues related to this form of work. Some objectives of the project. First of all, we want to keep occupational safety and health standards as high as possible. How we can achieve that? By identifying the hazards and the impacts related to each of these hazards. Of course, the major step is to find solutions, recommend some measures, and in that case, we want to keep them simple in order to be used by everyone. So the tool and the guide that I am going to present can be used by everyone. It's not necessary for experts of OSH only. Here you can see the structure of the Tele-WOSH project. Below, you can see the two main outputs, the application and the guide that I am going to present. We aim to give information to the teleworker on how to evaluate the risk. So we basically give them guidelines, how to proceed and how to have a final report of which is actually the risk assessment. We have 6 main categories that have been mentioned already by Dr. Sotiriadis. So we categorize hazards into 6 main categories. The first one is psychosocial. Some examples are the stress, the isolation issues. The economics, so economically inappropriate workstation. Safety, such as exposure to electricity. Biological, a very good example is COVID-19. Chemicals, is exposure to chemicals at home. And physical, exposure to a noisy environment. As I mentioned, Tele-WOSH has 2 main outputs. So now this is the first one, the application. You can download, even now, the application if you want. You can see on your screen the link, www.telewosh.com. You can download the application on your desktop, either on your mobile phone. If you join the application, you will see a welcome note, as this one now on the screen, and you can click on the instructions below to have an overview on how to complete the risk assessment. Before you begin, you can add information such as your name. It's not mandatory. If you want, you can give a name to your risk assessment. For example, here is a label, and I gave the name testing here. You can also see the date, the starting date of your risk assessment. you can have as many assessments as you want as a user. Moving on, you can see the 6 categories: economics, physical, safety, biological, chemical, and psychosocial. And you can choose how you want to start. For example, for now, use the first example, the economics. So if you choose the category number 1, economics, you can see subcategories. Like this, chair, desk, screen, keyboard. Let's say you have to choose the first subcategory, which is the chair. First of all, you can see some information about what we recommend about your chair, and then you can see below the hazards related to the chair. So here is a non-ergonomic chair and defective chair. Moving on, if you choose number 1, which is non-ergonomic chair, you will find some required measures and optional measures. So below is the recommendation. It's not necessary to have or do these measures, but to apply these measures, but the required is mostly the legislation. So you can, again, it's the first example I've chosen. You can, choosing the first required measure, the stable chair, you will see a video or a picture related to this. And you have to evaluate the risk by yourself and choose if this is already an existing measure or not. So here there are 3 levels of risk. If you, there are also instructions on how to evaluate. Oh, sorry, yes. And then you can tick if this is an existing measure or not in your workplace. Overall, we used interactive 3D scenes to make it more practical, to show simple examples to the teleworker, what we mean by a non-ergonomic chair and what do we recommend. For example, for this example, for the example of the chair, we needed to be stable, in good condition, adjustable seating height, supportive backrest, 2 armrests that are not too long. At least we want them to be adjustable in height as well. And of course, you can choose any other category you want, and this is how you can complete the application. And by the end, you can have the report of your final risk assessment. In order to have the report, you have to fulfill all the categories. If you don't want to use the application, everything is on this guide, the teleworking guide. So part of the dissemination and exploitation activities and aiming to raise awareness on the management of teleworking. This is the last output of the project, the teleworking guide on occupational safety and health during COVID-19 pandemic. It's available on this website, on SAFETY's website. You can find the project, the Tele-WOSH project, and you can download for free the guide. I will show you some examples of some parts of the teleworking guide. Again, I've chosen the same examples as before. I've chosen the economics. Here you can see the subcategory of desk and screen. Of course, we couldn't use the 3D scenes in this guide, so we only use some photos. Here you can see The risk assessment about the posture, the right posture when you are working, and recommendations on, this is a picture about the recommendation on the right posture when the teleworking wants to lift the load. We have also recommendations for example, for noisy environment to use headphones. Concluding, this study is taking into account the challenges, as Sergio's mentioned, of teleworking from another perspective that deals with the workers' well-being and therefore the quality of life, which finally contributes to social progress. If teleworking is managed well, then it could also lead to higher productivity. Here is the Tele-WOSH team and the contact details if you need further information about this subject. Thank you.
Thank you, Cleo, for this very interesting presentation and the very interesting application, Tele-WOSH, which I find it as a tool mostly for the employees rather than for the employers, because it is for the employees to use when working from home, mostly, you have correctly understood. And with this, I could say that employees are becoming more responsible when working from home, more responsible, taking care for their own safety and for their own health, rather than waiting from their employers to do everything for them. So they are becoming part of the equation, the employees as well.
I think it's good to discuss this later on.
Yeah, that's why I'm
yes.
saying this. Okay.
Yes.
Well, thank you again, Cleo.
Thank you.
Now we are moving to the third presentation from Mr. Kourounis. How pandemic affected the personal protective equipment market. Fit validation more important than ever. The excessive increase in demand for personal protective equipment for healthcare workers and the general population has led to a rapid increase in raw materials in specific categories, has created many new users of personal protective equipment and overall has created new facts about what is acceptable, what is allowed to be provided. Now, the most important topic to be discussed is if every single user gets the effective protection needed, every single time wears a respirator, a pair of goggles, etc. But when performance, the protection provided, depends on the fit, all users, especially healthcare workers, are entitled to know why, to know by what means and under what conditions they will get the protection they deserve. This is the topic of Mr. Kourounis, Theofilos Kourounis, a chemical engineer, postgraduate at postgraduate studies in business administration, worked since 1993 in different positions, commercial and technical, for multinational and local companies, and also as study and independent business consultant. Since 2010 till 2020, worked for 3M as sales executive, technical and regulatory affairs for traffic safety, personal safety, commercial solutions, and passive fire protection, governmental and military work markets, Greece and Cyprus, member of the Hellenic Technical Chamber, creator and lecturer in many courses about occupational health and safety, with over 2,000 training hours within the last 5 years, co-originator of the technical course 3M Science of Safety Expert, certified by the TUV Hellas, TUV North. Mr. Kourounis, how pandemic affected the PPE market, fit validation more important than ever.
Good morning, everybody. Thank you, Xavier, for introducing. I would like to say a great thank to all the organizers, especially for the Cyprus Safety and Health Association, but also the University of Thrace and the management force, who for many years is supporting this event. Now, as I mentioned in the beginning, the pandemic gave us the opportunity to be more in the same panel, because the international participants gave an extra significant importance of this council. So yesterday I really enjoyed all the presentations and the discussion, because I saw a lot of new ideas how to connect health and safety at work with sustainability, productivity, social responsibility, etc. My presentation is not about the people that or can telework. This is about the people that cannot telework. They are the workers in the front line for in the industry, and now they are facing new challenges about the equipment that can have. So before started, I would like to just add 3 words about my perspective. For many years, I'm working for PPE market, even as a sales guy, or even as a consultant or a trainer. And I strongly believe that PPE is not about only regulatory. It's not about only compliance. The success behind PPE has 3 major pillars. One is to find a way to choose the right personal protective equipment in any case. And there are tools behind it. The second pillar, in order to have a successful health and safety program at work, is about training in a different continuous ways, different manners, etc. And the third pillar is to validate the fit, meaning that not to ensure that every person has the right, not only the right equipment, but this equipment fits well with him or her and really protects as needed. So before starting, I would like to say a few words about the organization now I'm working with, which is Vanos SA. Vanos SA is a Greek origin trade company quite old, founded in 1929 in Piraeus, now serving accounts of marine, ship repair, heavy industry and construction, armed forces, law enforcement, and civil protection, mainly in Greece. With huge logistic capacities and owned fleet of 35 different size vehicles, many certifications. But for me, the most important is not the size of the company. It's about how this company works for safety and how we support our major solutions that we can offer. And we are given huge importance to offer field validation service, to train the end users, or to give special trainings, to inspect, service, and repair the equipment that we are selling. And these are the most important partners that we distribute, and every one of them can be part of another safety issue in the industry. I will not go further. I can give details for anything at the end if needed. So let's get started. This presentation is about the market, how affected, mainly in European Union. This presentation is also about fit validation, but actually there are no two different topics in one presentation. As we will see later, there is a strong joint between these two subjects. I believe that a day that changed the market is when World Health Organization announced that or suggested new measures about healthcare personnel, how to treat patients that may affected with new coronavirus. If you will notice the date, we are in the beginning of 2020, January 12, and the name of corona was novel coronavirus. Now it's more sophisticated, something like CoV/SARS-2. In this announcement, 4 categories of protective equipment came in the table: gloves, gowns, eye protection, and fit-tested particulate respirators. N95 or equivalent or higher level of protection. Most of the people recognized only this equipment and forgot that this was an announcement for special personnel. But this really affected the market. and affected the market, especially for respiratory protection, respirators around the world, or in masks in general, as we call this kind of equipment. But what is really a mask? Mask is, I believe, an Latin origin word meaning or have different meanings in Greek languages. So there are different kind of masks. Ladies may know beauty masks, or some guys also. We have Halloween mask, we have diving masks, etc. Of course, nothing of this equipment is or can be recognized as personal protective equipment for work. And as all we remember, there are mainly two categories that suggested for general population: disposable, medical, or surgical, in some cases masks, or reusable textile masks, which can be washed. Of course, these categories are not or cannot consider as a personal protective equipment. Why? Because protective equipment is about any wearable or carryable means that can protect user against at least one hazard. This kind of equipment is not intended to protect the hazard, to protect the user. It's about to protect the environment from the user, the surrounded ambient from the user. So, two different things. Last year in July, after the confusion around the world, the British Institute of Occupational Health and Safety created this infographic, trying to explain the difference between three different categories of equipment. One is face covering, the simplest, the mandatory for everybody in everyday life. When we are out of our bubble, we have to wear such equipment. Different is the surgical face mask, which has a limited certification, and respirator is another story. I believe that the confusion is also logical, because we are hearing about protocols in many different situations and categories. So there are protocols which have to do with the public health. Different ones for food industry or pharmaceutical industries, when industrial hygiene and good manufacturing practices also have some equipment in use, and I believe that the higher level is health and safety at work. As we moving forward or downward, the products that may be used have more complex features. The certification procedures are getting higher, the training required for people, and at the end of the day, the provided protection is much higher, or should be. So what happened in the market after the pandemic explosion around the world? Some facts that may help us to understand some new challenges. As mentioned, I was working for 3M. 3M is the larger producer, manufacturer of disposable filter face pieces. Respirators like ones that needed now for healthcare around the world. 2019, global manufacturing capability of 3M was 700 million of pieces around the world. 90% of this capacity distributed to industrial sector. And when we are talking about industrial, we are talking about cement manufacturers like Titan we met yesterday, like PMI, like pharmaceutical operators around the world. Not only for healthcare, but remember that also all the production forces that now are producing the vaccines against the pandemic also need to wear such respirators. What changed in within next year, 2020? 3M claimed that managed to triple the production. Over 2 billion respirators produced around the world. It was not that easy to distribute around the world because there were some bans from country to country or region to region. But the fact is that even the producer announced that now, as the emergency, we need to give 90% of this expanded production to healthcare, leaving out a small part for the rest industrial. So this made a big change. Also, there was a new discussion about unvalved respirators. Industrial workers for many years knew that valved respirators have to do with the comfort. It's not about the protection. If I have a respirator who helps me to exhale the warm air, then I feel better. I can use my respirator longest as needed.
Theophile, as it is time that we are reaching the end, I would say that you may say some few things about the fit validation, because in fact,
I will move forward to it. Okay, so one other major challenge that is that EU recommended to for some means without CE mark to allow the import of them in the market. We faced a lot of counterfeit or price raise the raw materials increased up to 10 times, etc. So this is an example of the confusion. In one hand, European Union said, okay, for a small period, probably such equipment can be imported in the market, but in the other hand, one country, Denmark, raised an alert and said, okay, take care. This alert become a RAPEX message for every country. Then Cypriot authorities did not allow the import of this equipment, which in other countries may be allowed it to be imported and be used. So I would like to clarify that, okay, this kind of protection levels is not exactly the same. In US, they use N95. We use FFP2 in Europe. There are many differences. In terms of testing, the FFP2 are can meet higher level of protection. Also, we need some eyewear, and the eyewear may needed is goggles, not spectacles. And also for the coveralls, is important to have this special test about infectious agents. I will not go forward in details, but this is a really complicated test that should be followed. So here we are. Now we have many new users without the adequate training. We have various new models in the market, new hazards to evaluate, and that's why fit validation is more important than ever. Just a few words about what is really fit validation.
There is a question for you, as I noticed. So maybe you answer during the Q&A answer session. You may say a few things more about this topic, because we are running out of time. That's why I'm saying that maybe it's time we go to.
No, if I am correct, I have 3 more minutes, but I will summarize.
Okay, just summarize. Okay.
Okay. There are many facts that made validate important. We would like to confirm our choice. We will use it as to train the users to be confident in performance. In some countries, it is mandatory, but at the end of the day, maximizes the protection. We do suggest fit validation when we are choosing our equipment, or we can change models, or something change to the person, and could be, as mentioned, mandated by regulatory in some cases. One thing that is not so well known is that fit validation can also be a method to evaluate the combination in between 2 different equipment parts, like the respirator and the mask, or the helmet with the hearing protector, etc. So just a few words about respiratory fit testing before the end. We would like to clarify that the performance of a tight-fitting respirator is not about only the filtration. It's not only about the fit, it's about the compliance. If the user is able to wear the respirator as much time needed without annoying. Otherwise, the protection goes away. What we are trying to measure is not the filter, but is what is getting over and above filtering, the leakage. And there are many different kind of respirators that can be fit tested. Even the SCBAs should be fit tested. Fit test is not about personal responsibility, is operator's responsibility versus fit check, two different things. I will not go further for this, but keep in mind that even trained supervised wearers who claimed that have a good fit check their own failed to pass a real fit test. So
well,
there are different methods, different kind of equipment. I will not go in details. Probably in the discussion session, we'll have the opportunity to come back. So I would like to thank you. And,
thank you, Theophile.
And let's the discussion begin.
Yeah, just to remind us about the three speakers, Professor Elpidoforos Sotiriadis, Theophilos Kourounis, and Cleo Varianou-Kelidis. Thank you very much. A quick reminder, first, Professor Sotiriadis talked about some terms, work from home, remote work, teleworking. Then he talked about the categories of hazards, physical, chemical, biological, ergonomic, mechanical, and psychosocial. He talked about the advantages and disadvantages of working from home, flexibility, savings, motivation, productivity, and maybe there's a question here whether is it a real balance, work-life balance? Is it really a balance when working from home? Is it really a balance between work and life? Disadvantages, then some disadvantages were discussed. Health and safety challenges, medical issues, insomnia, obesity, back and neck pain, eye strain, etc. And some ethical issues. These were the topics by Dr. Sotiriadis. Then we had Cleo Varianou. She talked about SAFETY, education, counseling, consulting, and research activities of SAFETY. She talked about the regulation, the lack of regulation on teleworking. And then she presented the Tele-WOSH application, a very interesting application. She repeated the categories of hazards, as Dr. Sotiriadis explained. And then we had Mr. Kourounis with talking about the need to select the proper personal protective equipment, then have the proper training about the proper PPE and proper fit test, which we didn't have the time to talk about this enough. Then we had a discussion about the precautions when performing an aerosol generating procedure. What is a mask was a good question, and he said that not all masks are personal protective equipment. Then Mr. Kourounis talked about the 3 personal equipment categories, about the public health masks and equipment, about the industrial hygiene equipment for food safety and good manufacturing practice, and about health and safety at work equipment. Well, these were the topics that we had heard. I think that you have seen the questions, right? The lecturers. Did you see the question? Should employers pay for some of the costs keeping the home operational by the employees? That was the first question by Christos Dimitragopoulos. For example, hearing costs, electricity costs, etc. An employee that left no other person at home would not have to heat his home or have his or her lights on. Then
Xavier, sorry to interrupt, but we have they inform us that we have to answer through emails due to the lack of time. So
due to lack of time.
Yes, I copy and paste my questions, so I
have the questions, me too, so that I will send this them to you.
Okay.
If I am allowed, there is a very interesting question to Dr. Sotiriadis. Do you think that an additional advantage of work from home is the flexibility to have the home in a different country of that the work is located? How countries like Cyprus and Greece with high quality of living conditions can promote this opportunity and attract, let's say, international teleworkers? That's a very good question. I don't know if I have time to talk about this a bit more. If not, okay, we can close the session.
Thank you.
Okay. Do you have something to talk about this, Dr. Sotiriadis?
I would just say that this is a very interesting idea, and this might well be a trend that we may see in the future. People choosing to live in certain places and countries where they may enjoy better quality of life and continue to work remotely with their current employers.
Good. Okay. Thank you very much, Professor Sotiriadis, Dr. Clio Varianou Miguelidis, Mr. Theophilos Kourounis, and thank you all the audience for this very interesting discussion and presentations. We'll be back in the next session with me again as a moderator because there is a change in the program. I give the floor to Nisla, maybe.